Good evening, everyone. Welcome. We are delighted to be here with you this evening. My name is Javi Alvarado. I am the System Director, Social Work Department here for the Yale New Haven Health System. And I'm joined by Dr. Olson, who is the Yale New Haven Health Chief Wellness Officer. So I'd like to start by just talking a little bit about how important this sort of work is for Dr. Olson and I. So as clinicians, myself, a behavioral health clinician, and Dr. Olson, a medical doctor and the Chief Wellness Officer, the topic of stress and resilience, as I said, are very important to us. A lot of what we do in our professional careers here at the hospital and even in our personal lives revolves around developing and practicing resiliency skills, the power of positive mindset, gratitude, and how our thoughts affect our emotions. We have to pay attention to stress. We have to pause and reflect at times and ask ourselves, how is stress affecting me? How does it impact my relationships? How does it impact my health? And then we have to think about how do we mitigate the impact of stress, asking ourselves, what can I do to reduce stress, and how can I work toward good emotional health? I take great care to say the word reduce because we will never be able to eliminate stress completely. Dr. Olson and I believe that if we have a good emotional health, then we become much more aware of our thoughts, our feelings, and our behaviors, all of which are key in learning healthy ways to cope with the stress and the problems that are a normal part of life. If we can improve in these areas, then we're more likely to feel good about ourselves, have healthy relationships, and achieve better health outcomes. So there's a really important connection here, and something that is part of my practice. If we take anything away from tonight, know that our thoughts lead to feelings, and feelings lead to behaviors. And the trick here is, how do we intervene during this process to improve our mental health? In the therapy world, it's often known as cognitive behavioral therapy. So just a little bit about me and my experience, I guess you would say, with stress. So I spent about 29 years in the military, and I was deployed on combat on 2 occasions. My first tour was as a combat medic, and then years later, my second tour, I returned as a behavioral health officer. I spent a year in the country of Iraq, crisscrossing the country of Iraq, meeting with thousands of service members from all the branches. I met with their commanders and leaders, men and women who, as you can imagine in that environment, worked in very, very complex environments. And they experienced high levels of stress. My time there, my goal was to help them deal with the acute stress, to help normalize their response to the stress, and to develop positive coping mechanisms, to help them regulate their emotions so they could focus first on completing their mission, but just as important, to help equip them with tools to prevent longer negative effects that stress can have, to help prevent long-term impact of stress and trauma. So as you can imagine, stress and its impact was a critical topic. It was an everyday topic for these service members, and I have to be honest, I didn't always handle stress very well. At times, personally, it would impact my nutrition, probably not eating as I should, my emotional health at times. I withdrew and I didn't do some of the activities that I often preach to people, mostly around physical exercise and just connecting with other people. So whether you're a soldier, a civilian, a patient here at Yale, stress and its impact really is the same. And the opening slide here, is the slide up, Emily? presentation. The opening slide here is titled Regulate and Reframe for Relief. Simply stated, tonight we're going to spend some time talking about stress and how to better cope with stress that we all experience. Next slide, please. So here are some of our goals. We're going to include a brief overview of the biology of stress. We'll answer the question, where does stress come from? We'll also talk about the important connection between stress and our health. Understanding the connection between stress and our health is important, but again, even more critical is learning ways or strategies we can use every day to reduce stress. And we will practice a couple of those strategies tonight. One way we can reduce stress is through the power of positivity. So we will spend some time talking about the importance of having a positive mindset in life. Despite our challenges, despite the hurdles we come across in life, how can we develop a positive mindset? So we'll spend some time talking about that. I'd like to really stress the point that this sort of reframing is so important. Our mindset, our beliefs that shape how we make sense of the world and ourselves, it can truly influence how we think. It can influence how we feel and how we behave in any given situation. We're going to talk a little bit about, we will talk about resilience and the capacity that we all have to recover from difficulties, and how this resilience can allow us to thrive, to grow strong and healthy. And finally, an important goal for us this evening is to learn from each other. What have you learned about coping and resilience? Because you are all experts. Everyone on this call is resilient. Again, we've all faced challenges, and here we are. So we want to leave some time and space to hear from you, to hear from this community. Just being part of this community can help reduce stress. Having this connection with each other can be powerful. So we want to hear from you. We want to hear from this resilient community. What advice would you give to others? What helped you? How did you reframe your situation and cope with your challenges? Next slide, please. So what is stress? Well, first, it's important to understand that we all deal with stress differently. Our ability to cope can depend on many things. Genetics, for example, or our early life experiences, our personality, our social, our economic circumstances, all can impact how we deal with stress. Let me give you an example. So we know that older adults, most, not all, but most older adults report lower stress compared to younger adults. Now, this isn't because younger adults are weak or incapable. It's just that older adults have had more time to develop coping skills and resilience after their experiences with adverse events. I had a senior female Navy officer, and by senior I mean a high-ranking officer, who was responsible for 600 sailors or so. She said to me once that she had experienced a lot of pain and loss in her life. She had lost both her parents when she was stationed abroad. She lost a daughter to a drug overdose. As a child, she lived through poverty, and there was a sexual assault as well when she was a college student. And she told me that the pain and loss that she had experienced, and being resilient, coping during those experiences, allowed her to cope so well today. And she was able to pass that on to many of the sailors that reported to her. So in that case, clearly a resilient woman, a resilient naval officer who experienced stress and challenges, she learned from these experiences, she coped well, and she was able to bounce back. She talked a lot about how her connection to family, friends, and her colleagues there in the military supported her and aided her in being able to cope with all of the stress that she experienced in her life. So I've mentioned resilience a few times, and I just want to pause for a moment and define what resilience means to me. So I like to use and you may have heard this before, I like to use the rubber band example, right? And the rubber band example indicates that once you're pushed beyond what you can handle, stretching a rubber band, with resilience, you're eventually able to bounce back to where you are, where it was. I like to think, a lot of folks talk about bouncing back when you think about resilience. I like to think about bouncing forward, right? Each one of these challenges in life creates an opportunity for growth. It creates an opportunity for progress after stress. And I also want to reiterate that connections, friends, family, communities like this they matter too. They're very important. Study after study have shown that social connections are important. They are a protective factor. So please do not feel like you are burdening others. Seek others out and make these such important connections. So stress is our body's response to pressure. Many different situations or life events can cause stress. It's often triggered when we experience something new, something unexpected, or that threatens our sense of self, or when we feel that we have little control over a situation. An example could be a car accident. Sometimes maybe even a stranger who yells at you in a parking lot, or you receive a diagnosis of an illness such as cancer. The loss of a loved one, moving to a new home, all of these events can cause stress. Okay, so the biology of stress. So I'm not a doctor, but I'm going to get a little nerdy now. The hypothalamus is the part of the brain that you see here in red. It's the part of the brain that is in charge of our response, our stress response. So in response to stress, the body's sympathetic nervous system is activated due to the sudden release of hormones. The sympathetic nervous system stimulates the adrenal glands, which releases adrenaline, noradrenaline, some of those hormones. This results in increase in a heart rate, maybe blood pressure, breathing rate. And after the threat is gone, they say that it takes approximately between 20 and 60 minutes for the body to return to its pre-arousal levels. So as you can imagine, for some of us facing big challenges, it may mean that we are in a constant state of arousal for hours, maybe days at a time. And returning to the pre-arousal levels may take much longer for some of us. Next slide, please. So there's no way to talk about stress without mentioning the flight or fight response, and without talking about cavemen or cave women. So most of us have heard about the fight or flight response, and the example of a caveman in this case responding to a very stressful event, an attack in this case, right? And I don't know what this is. This is a giant scary cat, or let's just say it's just a giant predator. The term fight or flight represents the choices that our ancient ancestors had when faced with danger in their environment. They could either fight or they could flee. In either case, there's the physiological and a psychological response to this threat, to this stress. And it would help prepare the body to react to danger. And this response continues today. We go through the same process when there's some sort of stimuli or some sort of event that causes us stress. It's also important to note that the response can be triggered due to both real threats, like a predator, like a car accident, but it could be triggered by imaginary threats too. The idea of something happening, or you may have heard something, you think you heard something downstairs in the kitchen, may also cause that sort of stress response. So we've all been there. In terms of the physiological responses, I just want to go over briefly over a couple of them, right? So our heart rate our breathing increases. And the reason that this happens is that the body increases, wants to provide more energy and oxygen to the body. So we may need that to fuel perhaps a rapid response to this danger that we're experiencing. Have you ever noticed that your skin may become pale or flushed? So as the stress response starts to take hold, blood flow to the surface areas of the body is reduced, and there's increased flow to the muscles, brain, legs, arms. So you may become pale as a result, or your face may alternate between pale and flushed as blood rushes between your head and the brain. There's also blood clotting that increases in order to prevent excess blood loss in the event of some sort of injury. So it's pretty amazing stuff, I think. Another common symptom of fight or flight response is dilation of your pupils, right? The body prepares itself to be more aware, to be more observant of your surroundings, allowing more light into your eyes, better vision for the threat or the surroundings. And in some cases, some of you may have experienced trembling in these instances, right? In the face of danger, your muscles become tense and primed for action. This tension can result in trembling or shaking. So by priming your body for action, you're better prepared to perform under pressure, right? In this case, the stress created by this situation, an attack of a predator, can actually be helpful. It makes it more likely that you'll be able to cope effectively with the threat. And stress can sometimes help you perform better in situations where you're under pressure, like a presentation like this, or work at school. In those instances, stress can be helpful. So while the fight or flight response may be helpful in some situations, a constant state of fight or flight or a constant state of stress can cause problems. A constant state of stress can increase the risk of potential mental health problems such as anxiety, depression, post-traumatic stress disorder. It can increase the risk of substance abuse problems, sleep problems, pain, or other sorts of bodily complaints such as muscle tension or headaches and so forth. The bottom line really is that the long-term fight or flight can wreak havoc on our bodies. The long-term stress can cause problems. And it's surprising, but in fact, many people live under chronic stress and suffer many negative consequences, and yet are not aware of this fact. It's important that we have an awareness and that we take steps to reduce our stress. I mentioned mental health concerns. One important note that I wanted to make was that while the fight or flight response is vital self-defense mechanism, there are a smaller group of people who have an overly sensitive response. For these individuals, symptoms occur far too frequently, or they happen at inappropriate times. And there could be, a number of reasons for that. Sometimes it's an imbalance of hormones, and sometimes we see this in people who are diagnosed with an anxiety disorder or even bipolar disorders. People may be overly sensitive if they're diagnosed with post-traumatic stress disorder, sort of a hyper-arousal, hypervigilance. For some people who have a history of verbal or physical abuse, they can be overly sensitive to this stress response, or coming into contact with an object of some sort of phobia. I had a college roommate who had arachnophobia, scared of spiders, or agoraphobia, specific fear of a particular place or situation outdoors is an example. So even in these cases, however, an overly sensitive response, as we just talked about, the behavioral strategies that we're going to review in just a moment can be very helpful. Next slide, please. So if you have never experienced stress, raise your hand. I can't see anyone out there, but the likelihood is that no one raised their hand. Everyone feels stress from time to time. There are different types of stress, all of which carry physical and mental health risks. A stressor may be a one-time or short-term occurrence like traffic or a exam, a test if you're a student, or it could be an occurrence that keeps happening over a long period of time, like being in a relationship or raising children or health issues. And some people cope with stress more effectively or recover from stressful events more quickly than others, but we all experience stress. And for many of our patients, we're very aware that stress is a normal response to health issues. And in the face of the day-to-day constant stressors, the anxiety, depression, the pandemic with no end in sight, it seems, we can see how someone can turn from thinking that their situation is temporary and resolvable, sometimes feeling helpless and having hopeless thoughts without some sort of form of intervention. It's easy to see how someone can remain stuck and lack, the physical or mental energy to change their situation. Next slide, please. So let's talk a little bit more about the connection between stress and health. There is no doubt that the length and the severity of stress can make a huge difference on how our bodies may react. Prolonged or heightened stress can have a more long-term effect on the body than short-term stress. If it's sustained for long periods of time, it would also increase the chance of physical health conditions either developing or worsening. And research has shown a connection between stress and chronic problems like high blood pressure, obesity, depression, and more. There have also been studies that indicate that psychological stress even leads to delays in healing, in wound healing. And I find this really fascinating. Individuals who experience greater levels of stress are more likely to increase their alcohol and tobacco use. They're more likely to decrease their participation in physical activity, more likely to experience, as we mentioned, sleep disturbances and perhaps make poorer diet choices. And these negative health behaviors, these practices can then compound the detrimental impact of stress on the physiological healing process. So while there are many factors that determine how rapidly you will heal, for example, your physical condition, your current immune state, any pre-existing conditions, stress remains a major factor in this equation. Plenty of scientific studies have shown the impact of chronic stress, how it could have an impact on wound healing, as I mentioned. In other studies, researchers have created wounds in both animals and human subjects, and then they closely monitor the wounds to determine the impact that stress might have. There's an example of a study that occurred on wound healing involving the study of caregivers of dementia patients. One of the most stressful healthcare jobs you can probably have on the planet. A very small skin biopsy, a punch biopsy, was created in the caregivers, in the control subjects who were not caregivers, and those who were not caregivers. And guess what? The caregiver subjects took 20% longer to heal. So stress is part of the equation. Next slide, please. So what's the impact of chronic stress? Chronic stress causes serious damage. For instance, we talked about sleep deprivation, just one of the many manifestations of stress. And that, as we know, can lead to loss of cognitive functions and weight gain. Living under a high state of stress, a high alert, can also alter the brain. It can induce long-lasting changes in both its structure and functioning. For example, high levels of cortisol causes stem cells in the brain to malfunction, and doesn't allow them to turn into neurons. And this could explain why chronic stress affects learning and memory in negative ways, as we know that neurons are the basic working units of the brain. So while sleep deprivation alone can lead to weight gain, living under constant stress can also change the way a person eats. Many people tend to overeat when stressed, and they reach out for so-called comfort foods, which usually contain, it's usually the sugary foods, it's the high refined sugar snacks that we turn to, unhealthy or unhealthy fat. And I'll be honest, probably periods in my life where I was stressed and I would turn to sweets, such as ice cream, pistachio to be exact. So, before we reach for that pint of ice cream, I now, I do a check. I ask myself, is this stress? What might be causing the stress? And what are some healthier, more positive ways to cope with that stress? Never mind that gaining weight can cause poor self-esteem, which often elevates the levels of stress even more, creating this vicious cycle. But the great news is that we can identify stress and we can make positive changes. Next slide, please. So we're going to talk about a few behavioral strategies to help promote calmness, to help increase focus and help reduce stress. So the test for me when it comes to what strategies are the best, or what are the strategies that I recommend to folks, are they have to meet 4 criteria for me, right? So what can be performed anywhere? What takes very little practice to master? What provides immediate relief? And then the 4th is, are they free, right? As my son says, free 99, whatever is free 99, Dad. So the strategies we're going to talk to you about here meet all 4 of those criteria. The first intervention on this slide is breathing exercises. It's my favorite intervention because it meets the 4 criteria we just talked about. And in my experience, it provides immediate relief. And we're gonna do a breathing exercise. We're gonna do a visualization exercise, but I just wanted to familiarize the group with the other bullets here, the other strategies. So let's start with the breathing one. What makes the breathing so effective? One of the things that I first think about is that it's very difficult for us to talk our way out of strong emotions like stress or anxiety or anger. Just think about how ineffective it is when someone tells you, calm down, when you're in a moment of extreme stress. When we're in a highly stressed state, our prefrontal cortex, the part of our brain responsible for rational thinking, is impaired. So logic seldomly helps to regain control. This can make it difficult for us to think straight or be emotionally intelligent. But with breathing techniques, it's possible to gain mastery over our mind in a very quick and a very immediate way. And research shows that different emotions are associated with different forms of breathing. And so changing how we breathe can change how we feel. For example, when you feel joy, your breathing will be regular, deep, and slow. But when you feel anxiety, when you feel anxious or angry, your breathing will be irregular, short, fast, maybe shallow. When you follow breathing patterns associated with different emotions, you'll actually begin to feel those corresponding emotions. There was a study with veterans from Iraq and Afghanistan who struggled with trauma. And in that study, they found that not only did breathing exercises, breath meditation normalize their anxiety levels just 1 week after learning them, but also continued to experience the benefits, a full year afterwards. I've worked with many soldiers and taught them various breathing techniques. And if it could help soldiers who sometimes operate, as we mentioned, in extreme duress, then it can benefit the rest of us. Next slide, please. So we're going to practice deep breathing, and we're going to practice the guided imagery. But I want to first review one of the exercises called progressive muscle relaxation. So progressive muscle relaxation, or PMR, it works by increasing the awareness of the tension that occurs during stress, and then consciously releasing that stress, that tension. It creates a feeling of relaxation, both physically and emotionally. This one usually takes a little bit longer. You could be in a comfortable seating situation, or you could be laying down in bed. The goal here really is to tightly tense your muscles in your body, hold it for 5 to 10 seconds, then release them and allow them to relax. And what you would do is you would start with your toes, and then you would then move on to your legs, your pelvis, your stomach, your chest, your back, your arms, hands, neck, and so forth. You'll notice that how different states of tension and relaxation feel. And PMR, progressive muscle relaxation, doesn't have to be used in the moment, or usually isn't used in the moment. It's because it takes a little bit more practice, and you need to sort of have that quiet space to do so. So let's try a deep breathing exercise. I'm going to shut off my camera so that you can focus on my voice and focus on your own breath. Let's see if I can do that. Okay, if you're able to, let's start with sitting up straight. Try to get comfortable. Your feet are placed side by side on the floor. If you can, close your eyes. Place one hand on your belly with your pinky finger just above your belly button. Start to pay attention to the rise and fall of your belly. What you are feeling is your diaphragm working to draw air in and out of your lungs. Notice that as you breathe in, it feels like a balloon is being filled with your hand. And as you breathe out, it should feel like the balloon is deflating. Place your other hand on your chest and try to keep this hand as still as possible, to just let the diaphragm do all the work of breathing. While you're at it, relax your shoulders. You don't need your shoulders to breathe. Inhale slowly to the count of 3. Deep breath in, count to 3. 1001, 1002, 1003. Then exhale slowly to the count of 3. Keep your hands where they are. Take another deep breath. Take these deep breaths as I talk. Sometimes it's helpful to think of a word as you breathe out, like relax, or calm, or ease, or happiness. Think of one of those words as you breathe out. Thinking about the words relax, for example, it turns the word into a cue. It's a hint, a signal. The brain will then associate this word with the action of inducing a state of relaxation. Stay focused on the action of your diaphragm. Your bottom hand should move outward as you fill your lungs with air, and move inward as you exhale. I'm back. Am I back? I think I'm back. So deep breathing techniques can help your body feel immediately relaxed. You can do deep breathing exercises anywhere, anytime, and no one really will know what you're up to. It's a simple technique that can really help you sustain greater well-being and lower your stress levels. Next slide, please. So we're going to do one more exercise. And again, it meets the 4 criteria we talked about. It's free. You can be done anywhere. It has an immediate impact. So we're going to try a guided imagery exercise. And for this one, I'm also going to shut my camera off for just a moment so we can, again, focus on our words. You can close your eyes and really try to use all of your senses during imagery exercises. So we want to, during imagery exercises, we want to use the power of the mind to evoke positive emotions. It works very simply. You imagine a very relaxing scene in great detail. It may sound simple, but trust me that it works. So again, it's really important that we try to engage all of our senses: sight, sound, taste, feel. We're going to use a beach imagery exercise because that's one of the places that's most calming to me and for a lot of people that I talk to. But it could be the woods, or it could be the mountains. For a psychiatrist friend of mine, he would imagine himself in a barn. He grew up out in the West, and the smell of hay and the smell of, believe it or not, horse manure was very relaxing to him. But it could be anywhere that's relaxing to you. So in this instance, we're at the ocean. We're going to close our eyes. We're going to begin again with a few long, deep breaths. As you breathe in, I want you to notice the cool ocean air that's filling your lungs. And as you exhale, soothing, warm air going out. Let all of your thoughts float away as you bring your attention to your breathing. Breathe in, breathe out. You might mentally scan your body and notice if you're holding any tension in your muscles, your neck, your shoulders. If you are, just gently let all that tension melt away with every out breath. Bring your attention to your breathing again, in and out. Now, see yourself walking down a long, narrow path towards a beautiful beach. Your bare feet feel warm sand, and you feel more and more tension just gently melting away from your body. As you continue down the path, you notice the bright white sand stretches down the shoreline as far as you could see. The ocean is a deep shade of blue with the fine white crest of the waves sweeping towards the shore. You reach the end of the stairway and you step down, sinking into the warm, soothing sand. As you rub the sand lightly between your toes, a soothing sensation of relaxation gently melts through your entire body. You can hear the roaring sounds of the sea surf, the waves crashing over each other. These sounds calm your mind and they allow you to feel even more relaxed. You begin walking slowly towards the edge of the water, and you notice the warm sun on your face and shoulders. You can smell the salty sea air, and you take a deep breath. You breathe slowly and feel more relaxed and refreshed. Finally, you're at the water's edge, and you gladly invite the waves to flow over your toes and ankles. You watch the waves again glide smoothly towards you, gently sweeping around your feet. The cool water feels soft and comforting as you enjoy a few moments allowing yourself to gaze out Overhead, you notice seagulls gracefully soaring high above the ocean. You can hear their soft cries becoming faint as they glide away. And all of these sights, these sounds, these sensations allow you to let go and relax more and more. After a moment, you begin strolling down the beach at the water's edge. You feel a cool, gentle breeze pressing lightly against your back. And with every step, you feel yourself relaxing more and more. As you continue with your walk down the beach, you notice a colorful beach chair resting in a nice, peaceful spot where the powdery, soft sand lies undisturbed. You approach this comfortable looking beach chair, then you sit down, you lie back, you settle in, you take in a long, deep breath, breathe slowly out, and you feel even more relaxed and comfortable resting in your chair. Let yourself enjoy the sights and sounds of this beautiful day on the beach. And when you're ready, you can gently bring your attention back to the room, still letting yourself feel nice and comfortable sitting where you are. So now that you're feeling relaxed, I hope, we're going to turn it over to Dr. Olson, who will talk to us about the power of positivity.
Hello, everyone. As we are feeling our feet in the ground and our sit bones grounding us, and we are feeling more at peace after this exercise, we can feel our spines holding us up, and we can be present right here with us now. And it is common for us humans to what is called the monkey mind, where we perseverate about the same things all the time. And we are also known to poke ourselves with a second arrow when we've had an injury. We keep replaying and poking us with that same injury again and again. But we can enter into this space today with all that we experience it is to be human, and we can share what we've learned along the way in our own journeys on how we have mastered this art of being human. We can come to this space, forgive ourselves for our foibles, accept ourselves as we are, and know that we are always learning to make the most of our lives and our struggles, and that we come here together to share. Next slide, please. The power of positivity. We're all born with a certain disposition. About 50% of our optimism or disposition is what we're born with, but we still have some of that to work with, and we can learn skills of how we want to be, so that we're not always, stress can help us to learn, it can keep us safe, but chronic stress, as Javi was saying, is harmful for us, so that we can become more aware and we can choose of how we want to be. So we want to cultivate positive emotions and the power of positivity. It is not to say that cultivating positive emotions means that we have these Pollyanna ideas that everything's fine because stress keeps us safe and healthy. It's more that we have the ability to be in control in times of stress, and we have the ability to manage it just a little bit better as we learn from each other. And I'll share some of what I've learned from my mentors and teachers and role models over the years. And one of those mentors, role models I'd like to thank is Dr. Professor Steve Southwick, who I've learned so much from over the years. And so stress can be there to protect us. And one thing that I've learned from him too is the tool of saying, thank you, stress. Thank you for trying to protect me. I know you're doing that on my behalf. I appreciate that, but now I can take it from here. And you're not giving up what is to be dealt with, this challenge to be dealt with. And you're not saying it's okay that you have something that is stressing you. You're just saying, I'm gonna take it from here. Next slide, please. So here's a little model to help us to think about tools and different ways that we can use our stress to power our success. There's a certain level of stress where it motivates our learning, but then there can be too much stress, and that's too much for us to handle as an individual. So it's important to know where that tipping point is for you, so that if you get to the point of overwhelm where it's too much for you as an individual, you can reach out to a friend, or you can reach out to a mental health professional who knows how to work with people to move them through that overwhelming stress. And then some of the tools that we can use to help us with our own stress is the mindfulness, like we just practiced, a way to quiet our thoughts and to open the space so that we can become more aware and accepting of the feelings and emotions that we have. And once we have those feelings, we might name them. There's an acronym NURSE in healthcare that we use, where we name, try to understand what that emotion is, respect that emotion, and support that feeling that we're having, and explore it further as it gives us more information. And we can recognize from doing this that those thoughts, as Javi was saying, those thoughts that we have lead us to have a certain feeling, and then we behave in a certain way. And I'll give you an example of how we can change our thoughts to change how we feel, or question ourselves. For example, if your partner, you don't get to see your partner much, and there's lots going on at home, and then your partner goes to do some other activity to refresh and rejuvenate themselves, say go to the gym, you might say, oh, my partner doesn't want to spend time with me. And you may withdraw and then be away from your partner and not spending time with them. And that serves as a confirmation bias of the thought. But if you changed your thought, or you investigated your thought and thought, maybe my partner likes to stay in good, healthy condition for me for a long life together, that might change how you feel, and that might change how you behave in response to that thought. So that's one way that we can be more aware and be in control of how we feel. Another thing, when it comes to negative emotions, there's an acronym called RAIN, in which you recognize an emotion, you accept the emotion, you investigate it, but the N means not identify with it. So you are not your emotions. This may be what you're experiencing right now. It may be fleeting, it may be long lasting, but it's not you. It doesn't define you. You are going through something at the moment. So if you'd like to share with each of these, if you'd like to share with others things that you have done to quiet your mind and to feel able to register your emotions, say you walk on the beach, or you do the mindfulness exercise, or you meditate, or what you do this when you go fishing, or walk in the woods. If you'd like to share any of those thoughts with others so that we can learn from each other, feel free to enter those into the chat. The next thing that helps us to feel more in control of our situation and our stress is to know our meaning and purpose, or look for meaning and purpose in our lives and in what we're experiencing, and how it fits in, and how do we spend our budget of our lives, our time, our resources. How does this fit into a meaning and purpose? Does it give you, does it change? Does it give you new clarity, this stress? Does it change your purpose? Does it change your priorities? And when we know what our priorities are and our values are, it can help us to make decisions that, so we're not paralyzed by our stress. It can be some of our true north guiding principles that help us get through that. The next thing is how we cultivate mindset. So when we think about how is our mindset, is it helping us or hurting us? And how might we cultivate a more positive mindset that can help us? One example of this might be if you're having trouble in a relationship is strained and someone isn't treating you well, for example, it might be easy to say, this is terrible and I can't handle this, or that to feel like you have no power. But then you can also turn it into a growth mindset where, what can I learn from this experience and how can it help me to grow stronger? Or what might I use from this information to move forward? Growth mindset is also where we might feel that things didn't work out the way we wanted to, but we learned from it and we can be better the next time we try that. Or a grit mindset might be something that helps us to persevere through something. Another mindset might be acceptance and the wisdom of knowing when to accept that is a power in itself. So you might think, what has worked for you in what matters to you? What did you find through your struggles that defined your purpose, and what's really meaningful to you, and how that changed your life through a struggle that you discovered something. Another thing is mastery, and mastery is not that we pursue perfection in mastery, but that we continue to try. That when we are looking to overcome stress and to achieve a certain goal or a way we want to feel or what we want to accomplish, that we think about it and we try and we execute on our plans. And when we try, we can feel our own power. And even if what we want to accomplish doesn't work out, we have learned something. And when we know that we can get up again and try again, or use what we've learned from that to do it better the next time, it's the pride in the fact that we tried, because it takes bravery to try something, to initiate. And can you think of a time when you were fearful or didn't want to take that step? You had some inertia, you didn't want to move into that, and when you did it and you conquered something, and the sense of accomplishment that you had from just trying, feel free to share that as well, and to remember times when you tried and how proud you felt of doing that. Another way of feeling in control and in a sense of mastery is also in how we set boundaries. Sometimes saying no is a way of being in control, or saying this is not consistent with my values or my time or what I have to do. No can be a very powerful thing as well. Boundaries can be important, and those can be defined by what are our values and our purpose and our priorities. Another way to show mastery is through acceptance, and we feel a lot of pride when we get to the point where we've made a right decision. It wasn't what we wanted. We tried, we persevered, we exercised growth mindset, and something happened and it wasn't what we wanted, but we saw through our own wisdom when was the right time for acceptance, and we're proud of ourselves for having that wisdom and making that step. And you might think of times that you want to share where you were in a situation like that, and you can serve as a role model or inspiration for others. And the last one here is me time. And you can't be on going all the time in tackling your stressors or stress. You also need time to rest and rejuvenate, take care of yourself, whether that's a vacation, whether that is eating right, getting enough sleep. You want to take time to rejuvenate and rest so you can go the distance and you can recharge. And this is also a time of reflection where the lessons that you've learned and the experiences that you've had can also be consolidated, and you can recall what it was that you've been through and really reap those rewards. And through some of these things, you can do this in a power pause in a moment. You can do this in times of great stress. Sometimes we think about these are opportunities. So you can pause in a moment and go through these steps, or you can do these during big moments of your life. And it can help you move that stress reaction over to success in the stress response. Next slide. So here's the psychological response related to disasters. You may have seen this before, but in any time in our life when we go through a trauma, we might have our adrenaline kick in, and then after we survive a trauma or a stressful event, we might be lower than we were before. And this can be a time where we might feel bereaved meaning that we feel robbed or lost, or something valuable was taken from us. And we're going through a time of grief, and it takes some time to honor that loss and that feeling. And then in this point, you want to find out when is the point where you really have to move into the next step, because you don't want to stay too long in grief if you're starting to withdraw. And there are different ways that we withdraw from the world. So you just want to notice if that's happening, that it's beyond grief. And then if you need to, you can reach out to an expert, a mental health professional who can help you move through that. Or you might also find that reaching out to others that you trust, that you feel safe to start to disclose a little bit of how you're feeling. Then you find out that others have gone through these things as well. Because most things we experience as humans, others have also experienced, and they've found some nugget of wisdom that they can share. And if you talk to some different people, you'll find some different perspectives, and you will see it's possible to get through that. And then we'll go to the next slide, please. And this is just a reminder of there are no shortcuts in facing the challenges. They aren't things that we signed up for or we would want, or if we could get rid of them, they would. And sometimes it takes a while before the stresses are really relieved. And in that stress, we might say, who's driving the stress? Is the stress driving you, or are you driving the stress? As the stress gives you messages that something isn't right, that you feel somehow threatened, you might ask, what is your threat, and how do you come to terms with that? And what is the stress trying to tell you? And how do you want to be in control of you driving the stress and the messages that it's bringing you? What do you want to do with these messages? In the last slide, we talked a little bit about these events, that these are what some people would call a crucible moment. These events where they're so stressful, you feel like the rug's been pulled out from under you, you feel like you're free falling, and you are looking to put ground under you again. You're searching for why this happened, where is the meaning, how do I rebuild, what is really important. And it can sometimes bring a lot of clarity, but it's not comfortable. It's not comfortable to feel in a situation like that. Sometimes you feel like maybe someone has wronged you. You might feel blame or guilt or something, or your life just didn't go as it's supposed to, and you are looking for what's the meaning of this. And through these crucible moments in our lives, which are very stressful, we sometimes get clarity, and sometimes that rumination of how do I handle this? How do I get through this? It's the rumination that can sometimes lead to PTSD or other stressors and mental health consequences. And sometimes it's that stress of how we drive it that can bring us to new clarity and new understandings about our life. Next slide, please. And that some people have experienced post-traumatic growth through these experiences in our life, what we call these crucible moments. And as we go through these moments and we survive these moments and we rebuild through these moments, we might have a greater appreciation of what our priorities are in life, what's really important to us, who's really important to us, what is our true north, what is our purpose and meaning in life, how do we want to spend our lives. We might find that we're open to new possibilities, that some of the things that were closed to us have opened up new things that might possibly even be better than they were before, but it's only openness to the possibilities that we might discover those. There's also the fact that we might find out that people showed up for us, or people shared with us, or people helped us to get through this stressor. And it's not always who you think it should be. And sometimes the people who you think should show up aren't necessarily equipped to do that, but somebody does. And we develop deeper relationships when we are open to having people help us. We also might find that we have a greater sense of strength about ourselves that we didn't know that we had. And as Javi was saying in the beginning, some people who've been through all of these stresses have discovered that they are much more resilient. They're stronger than they thought they were, and they can go through a lot. And something that would otherwise phase someone else didn't phase them, because they said, I've been through a lot. I know I have the resources. I know how to handle this. I've learned along the way of dealing with these things how I might move through this one. But again, sometimes you have to gauge if it's too overwhelming for you to do alone, or just you shouldn't do any of these things really alone. It's better to connect. But you also need to know when you want to seek a professional who really knows how to move people through these overwhelming stressors. And so the spiritual deepening can come when we start to have more of the clarity about our lives, the meaning of our lives, the purpose of our lives, the priorities in our lives, that sometimes happen as things feel threatened. We really start to sharpen our impression of what is our lives and what we want it to be. Next slide. So if we were to boil it down, you might think of feeling calm and control and connected. By calm, we mean ways that we can cultivate positive emotions so that we can feel hopeful and optimistic in a realistic way to carry us through, that we feel grounded in our meaning and our purpose and something perhaps bigger than ourselves as we're connected with others. We feel more in control, whether that's through the acceptance, the wisdom of our acceptance or our boundaries, or as we take action and we gain confidence through our trials and our experience, and we get better and better and better, and we feel more and more able and capable of the things that we want to accomplish, and a sense of accomplishment from those learnings. And then connected, we want to be our authentic selves, and we want to be accepted as our authentic selves, and to belong to others, and to feel that we're engaged, present, and we want to feel the joys of giving and taking and being connected in that way. And as we put all this together, we are going to feel engaged in our lives. We're going to feel absorbed and committed to and in the flow, kind of beyond ourselves and our limitations. Next slide. This is Karen Revick's photo. You can follow her on Twitter. She has a whole series of photographs. She's from University of Pennsylvania Positive Psychology Center, also one of my great teachers. And she recognizes that there's beauty everywhere. And when we start to look for it, as she does through her photography on a daily basis, she finds beauty in the most ordinary places. And here's beauty everywhere, including in this sunset of looking through a glass. And once you start looking for it, you will also find it every day all around you. Next slide, please. So if you feel like you're dragging in your day and you want to fuel your day with some gas, I call this as a little way to remember, gratitude, awe, and savor. Just like through the lens of Karen's photography or the window through which we look, we can change our view, our point of view, and we can cultivate positivity. And you have to try it before you can doubt it. And that would be give your pause and stop for gas. Give your day some gratitude, awe, and savor. And gratitude is anything we can find to be grateful for, and to give is greater than to receive when it comes to your own well-being. So be generous with your gratitude and see all of the abundance of positivity that comes your way in that. And then awe is the experience of wonder and wow. And take a moment to allow yourself that wow experience. And savor while you're in the moment. Notice it, pause, soak it in, take it in, savor it. And this is one easy way you can fuel your day with gas. If you find yourself in a stress response, in between that stress response to the success reaction, you can, if you don't know what else to do, just give your day some gas. And these are ways that positive psychology can transform us. And it's easy to say, and it's hard to impart on you the power of positive psychology unless you practice it yourself. So I invite you to take 2 weeks and practice some of this every day and just see what happens as an experiment. That's an experiment we can all try for 2 weeks. And then see what you think after your 2-week experiment. Next slide, please.
Hi, so this slide here, Christine, is just some resources. So Smilow has integrated medicine website that you can connect to, where there's a number of videos, helpful videos, and some of the exercises that we did today are also available, some meditation exercises. So you can just go to this website here, and what we can do is, Emily, can we copy and paste that into the chat, the website there, the Yale Cancer Center website? And maybe we can do that at some point. Perfect, beautiful. Next slide. And as we talked about earlier, some of the best things that we could do are those things that are free, right? We're more likely to use them. And if you go onto that website, on the bottom right corner of that slide, there are 3 apps that are available that are absolutely free and really helpful. The Mindfulness Coach app and the PTS. I have all these 3 apps on my phone because when I talk to folks, I like to pull them up and walk them through it, but they're available there. Can we paste that one too on the chat, the bottom right website? And it's the Veterans Administration website for those of you who are interested, and that's just a reference. So maybe we could, can we end the slideshow, Christine, and just sort of talk about maybe folks want to share or have questions. We can quickly review some of the comments that were made. I don't know if people were minding the chat, but Alicia talked about how helpful it is. Some of these breathing exercises are helpful for her. And she has certainly felt the stress and how it's negatively impacted her life. So thank you for sharing that, Alicia. Christina took up oil painting to reduce stress. So that's another very therapeutic way. It's very calming and relaxing to be able to just sit there with yourself and paint. So thank you for sharing that.
Yeah, I love the green. She
Yeah,
found green.
I don't know if it's true, but that's what I've heard. It's one of the most soothing colors because it just reminds people of nature. Uh, and nature can be very spiritual for people, I think.
Yeah.
And then Liz, something that we didn't talk about, I'm so glad that she brought it up, was acceptance and how key it was for her in her journey. And she's seems to be in a better place that she's practiced acceptance. And then I just responded that, I think some people think that when you accept, you're ignoring, and that's not what you're doing. You're recognizing, acknowledging the emotions that you're having, but you're then taking the next step, which is allowing it to be and just saying, sometimes, it is what it is. And you can always return to it at some point if you need to. It's a choice that we make, right? It's the mindset that we talked about.
And we don't have to poke ourselves with that second arrow when you're dealing with something stressful. You don't have to also add to your own stress.
Right. That's great. Such a great point. In terms of finding a therapist, a couple immediate thoughts I have is that, for those of us who you have insurance, all insurances have a provider directory that you can go to and typically, be able to punch in your zip code and identify therapists, within your area. But also Psychology Today has a directory, and they have verified therapists on that website. Again, either punching in your zip code or the name of the therapist will pull up a number of therapists. Thank you, Sally. And the other, I just want to quickly mention that if when you do visit Smilow next or just Yale New Haven Health Hospital, any of the hospitals, you can always ask for a social worker, and I guarantee you that social worker will help you connect with a therapist in your area that works for you. So, and you can let them know that Javi told you that as well. So, do you see any other comments on there?
Somebody mentioned it not being easy, and I'm so glad. Oh yes, Alicia said that this isn't an easy process, and I'm so glad Alicia mentioned this because my mentor is always reminding me too that resilience isn't a class. It isn't in facts. It's a lifelong practice, and it isn't easy, and that's why it takes a lifetime. And it's all through struggle that we learn these things. So thank you for reminding us of that, Alicia. The other thing I'll mention is I'll send Smilow Cares the handout for those different resiliency framework. So if you'd like a handout, I'll send that over to Smilow Cares if you'd like to be reminded of those, with a little description of each of those. I'd be happy to take any more questions if anybody has any. I'm so glad for these comments because I feel more connected with all of you out there because I can't see you. So I'm so grateful for those.
So if there aren't any more comments or questions, thank you so much for being a part of this and for joining us today. I see a message from Emily that they'll be posting all videos to YouTube. And there's a link that she's added in the chat box, so that's wonderful. If you want to practice some of those relaxation techniques. I just want to, again, thanks everyone for being part of this community and learning from each other. Thank you.
Thank you.